Good afternoon. Nice to see you all. I'll just start with a quick, brief statement, and that is to say first, thank you all for being here today. We appreciate that. And I want to thank people who we've been working with. I want to thank the governor for his leadership in this issue. It's a fast evolving issue. The governor just finished a press conference where he and a director of public health shared the common sense and scientifically supported data on the best way for us to move forward. I think that's very important for our state and for our communities, and so I want to make sure to begin by thanking the governor for that leadership. And it's wonderful to have a partner and a friend in moving forward with challenges like the ones that are facing us today. And then second, I want to thank the people throughout the community at The Ohio State University who've been so helpful over the weekend and all day yesterday and today, and moving quickly for us to be able to address this evolving situation in the most productive and effective fashion that we can. No one has seen this happen quite like this before, so there's no cookbook or playbook about what one should do. What we're trying to do is to use the information we have, use the best information we can, and then make decisions that help us to move forward to protect our communities, and then in the case of our university, to keep our university function at the highest possible level, and we appreciate that very much.
Was there any one thing that prompted you to send that letter to the university yesterday, or was it just accumulation of all the information you gathered?
Well, you, like I, have been watching this over the last month, and we saw what happened internationally in China, and then we've seen what's happened in Europe, particularly, I would say, in Italy, where the cases have ramped up quite rapidly. And people in China didn't know so much what was happening, or when it had to figure out what was happening, but Italy knew it was coming and still found it very challenging to stay ahead, so we've watched that. We've watched what's happened at our sister universities across the country, and I'm in contact with university leaders across the country, and we had a choice here really of doing all we could to try to mitigate the hold and damage of the virus before we had someone become very sick or unfortunately die, or we could wait until after that happened to do the most that we could, and we wanted to be ahead of that and to do as much as we could to prevent those things from happening proactively.
Is that March 30th date, is that set in stone, or is that something that you're monitoring and going to reevaluate?
Yeah, everything is monitored. We're monitoring everything as we get new information. We want to take the best information we have and then apply that appropriately to get the best outcomes we can. We started with March 30 with a 2-week period, and we think we'll have more information certainly before we get there, but we will make good decisions based on the best information that we can receive.
Is there any fear of having
what we can expect for teaching and learning?
Yeah, I will say again, evolving quickly, and one of the reasons we worked so rapidly yesterday to try to get an announcement and put it out and send it to our faculty is that we're having to kind of create this as we go. We do a lot of distance learning now. We do a lot of online learning now, and we have a great capacity. We're pleased to do that, but we've never done anything like try to have our whole curriculum on as a distance learning platform or online, and to do that in a week is a Herculean task. And so I honestly yesterday wanted to get us started as quickly as we could, believing that every minute would be precious for that. And so we'll do our best to do that. You had a question.
Is there any conversation about the dorms or specifically cafeterias? I know the CDC has put out some guidance around that.
Yes. So I mentioned the governor and leadership of the Ohio Department of Health, and we appreciate that and have been monitoring that and participating with them in helping to make best decisions every day, and we'll continue to do that. We also monitor the CDC and the WHO and trying to be in contact with our colleagues there. And those guidelines, none of us, we can't avoid contact with other people entirely. What we want to do is to make that as safe as we can and to mitigate. So we've done things like, since this last week, mandated enhanced cleaning of areas that are high-touch areas, reminding all of you that the best protection is washing hands frequently and avoid touching your face. And so we want to use those mitigating procedures and behaviors. And we can't eliminate entirely the chance that someone will come in contact with a virus or become ill, but we can try to minimize the chance that that will happen. That's what we're going to be doing.
I've talked to a lot of students that are a little confused about how this is all going to work. What do you want to tell them about how this is going to evolve as it comes through?
Yes, I want them to know that their health and safety is our number one concern, so we're always thinking about that first. And then second, they're in school, they want to make progress through school, they want to graduate on time. So our efforts really today, as I'm speaking here, my colleagues are this minute working on doing everything we can to help ensure continuity of the educational process. And we're we'll do everything we can to make sure that they have outstanding delivery of educational content and get through their courses on time and continue to make progress. And we have to do that, and that's actually what we're working on as we speak. Something else I'll just say for the group, years ago, this is 2020, so 16, 17 years ago, when the SARS epidemic hit, I was in a different role. I was the Vice President for Health Affairs for the University of California. So we had the circumstance where we looked at how you might address an issue like this, and I was then the content area expert, the one that people were asking questions of. And it was helpful to have gone through that experience then to try to do what we could to keep ahead of this curve here. Everything's different time now, many more people traveling and other things like that than was the case before. But we try to learn from what we've done in the past and try to do the best we can as we move forward.
What are some of the challenges of moving to a complete online instruction within a week?
Well, the challenge, as you said, the challenge of moving to a complete online instruction within a week is daunting because many of our classes don't use technology actively. Now, many do, but not all do. And so moving to a different platform is something that will challenge our faculty. And I'll say, so online, just to be technical about it, a complete online course where you deliver everything online and have all the interaction online is different than a technology-enhanced course or other ways that we might deliver content virtually. So this won't be, we're not going to move to complete online education. What we're going to do is use online education where that is available, but use other things to deliver technology. Zoom, for instance, is a platform that lets you communicate with groups of people in shorthand. I teach undergraduates every week. I teach in that room there, and so we're going to work to put my own, I'm going to need to learn between now and next week how to get my course on Zoom so that it works. And I think honestly thousands of my colleagues are going to be really rolling up their sleeves and leaning in to do what they can to make sure that content gets delivered. You know, we have a worldwide circumstance that you've seen. It affects countries. It's affects hundreds of thousands of people. So far, 100,000 cases. There have been more than 3,000 people who've died. It's really strained the healthcare system in whole countries. It's caused Italy to change its behavior. The stock market has had incredible gyrations. So this is not a business as usual issue. It's one where we all have to roll up our sleeves and do what we can to move through, particularly these next couple of weeks, so that we can have the best outcomes for everyone. And I'm pleased to know that our community here is going to do everything they can to lean in and get that done.
Would it be your preference that the students who are not here right now, maybe at home, stay at home at least through the next 2 weeks?
Yeah, that'll be an individual decision for students. I mean, there's some students who will find it more convenient and appropriate to stay at home. There's some that don't have that as an appropriate choice. So we want to make it that we are here to support all of our students, and any who come back. Those who feel that they can get the content they need at home, then they're welcome to do that. We'll be in close communication with them. Yes.
That was mine, but I got another one.
Okay.
Some university leaders have been in touch with government agencies about what this means for students on F1 visas, and if they're not taking classes in person, that could be a problem.
Yes.
Did that weigh into your decision at all, and what are you doing to support the international students?
So what I'll say is we want to do what we can to support all of our students, and there are a variety of special circumstances that, you know, we have 68,000 students on our campuses, 60,000 on this one. So there'll be a variety of special circumstances that affect students, and all we can do is the best we can in each individual circumstance to address what each of our students needs and do our best first to keep them safe, and then second to help them make the educational progress that they come to us for.
So how will you make that decision come, you know, a few days prior to March 30th to either resume regular classes or to continue online classes?
Yeah, well, I'll repeat what I said before, is that we're going to take all the information we can and try to make the best decision, which we hope we do every day. In this circumstance, what I'll be looking for is the curve, and we're on the ascending part of the curve, the flat part of the curve, or the descending part of the curve. And it'll really be the descending part of the curve that allows us to know that we can begin to pull back on restrictions. And what we want to do is, and at some point we'll think that that it will be prudent to move forward. But we'll be watching the curve, number of cases in Ohio, number of cases in the country, and what that curve looks like.
Any special message for the families, for the parents, the loved ones who are supporting students on this campus and throughout the university system?
Yes, I think that this is actually an issue that affects all of us across the country in whatever line of work we're in or wherever we live. And what we all need to do is to do those follow the prudent public health guidelines that keep us safe. And so I want parents to know that we think about the safety of their students individually. I mentioned we have 60,000 students on this campus, and I said before that I think of each one of them as an individual that we have responsibility for, one at a time. And so it's a daunting challenge, but that's our role, and we will do everything we can for each person to keep him or her safe. Parents can help do that. I want people, this is not a circumstance actually where I think we should worry or have any kind of panic. It's not that at all. It's active engagement to do what we can to make us as safe as we can be and to have the educational outcomes that we wish. And again, sleeves are rolled up and we're focused on this, but our job is to get us from where we are to a few weeks from now and then into April and moving forward in the best shape we can be. And we think acting now is the best way we can guarantee a positive April.
A lot of students are worried about.
Let me defer.
Yeah.
Thanks.
Dr. Wright, you mentioned that you've been in touch with other university leaders, university presidents. Obviously, OSU being one of the largest public universities, you guys took kind of a leadership role on this. What conversations have you had with other university presidents as they have kind of tried to weigh this same issue?
Yes, thank you. So two types. So university presidents who I might interact with nationally, and we've talked about this actually for a couple of weeks in different ways as we saw things happening and kind of we're monitoring the different circumstances in each particular community. Each university is different and each university has to make its own appropriate decisions, but we were weighing that information. And then this morning we had a call of the Inter-University Council of my colleagues throughout the state of Ohio, and we had a robust conversation about things that we might do, ways that we might work together and to be collaborative. We want to do all we can to do that. And then we understand that the circumstances are different on different campuses, and I think that we're planning on having conversations at least a couple of times a week on a formal basis as we make decisions and implement them, and how is that going? How can we share best practices and things that we learn? This is all very new and evolving right now, but we are looking forward to continuing to work with our colleagues across the state of Ohio and then our other colleagues nationally. Yes.
Graduation.
Yes.
It's a large gathering of people in
Yes.
one space. Can you talk a little bit about that?
Yeah, graduation is really a culmination of years of work, and it's a dream come true for so many. It's one of my true favorite events of the year, so I really look forward to it, and we will hope that occurs on time and with bright sunny skies. We'll follow the curve that I've mentioned, and if it is the prudent and appropriate thing to do, then we'll celebrate our 12,000 degrees that we will be giving out this spring, and look forward to that very much. In every case, we'll evaluate things as we have new information going forward.
Along
That's
those
like
same
a
lines, the
spring
spring game would go together.
Yeah, well, you can talk in tandem, and I'll answer in tandem. Along those same lines, the spring game. Yes. Your question is the answer. Yes.
Have guidelines been given out to students or university staff about how they should transition to a more online-focused class?
We've given guidelines, I'll say in the short run, we've given guidelines and repeated guidelines about public health safety. So that's one thing that's new, and we've worked on that and worked on our colleagues who help to keep our university safe and clean have been focusing on high-touch areas, again, to try to minimize the chance of virus spread, so that's great. We are enforcing and will enforce social distancing, 3 to 6 feet of space between people, which we think dramatically decreases the chance of the virus being spread. So those things we've given specific instruction about. Our own students do online education routinely. I know in our fall semester, 37% of our students took at least one online course. And through the course of their time here, most students take one or more online courses. So they have experience with this, experience with Carmen, our delivery platform. But there will be some for whom this is a challenge or who haven't done much of it or haven't done it yet. And our work between now and Monday is really to help bring them on board.
What do you see as the biggest hurdle to?
Let me just, I'll move to the follow-up, and yes.
Yeah, so your usage of students that know how to use this online course, but what about professors who've never taught an online course before?
Yes, and so there are things like Zoom, which are very more simple, where you take your content as it exists and just put it out in a different platform. And so that is one thing that we're thinking of as a bridge for those professors who haven't taught online courses or haven't used technology. Most of our professors have, and most professors are linked with our Carmen platform, and then we're going to do everything we can to support those professors who have a gap, and appreciate honestly, I know that this is a big change, and we're asking a lot, but they understand that this is an unusual situation, and the way that we make progress is by rising to the challenge, and I know that they can do it.
What do you see as the biggest hurdle for moving classes online?
Well, golly, there are, so in the thousands of classes we have, there are all kinds of different types of information that is being transmitted. So some suits itself to online transmittal very, very simply. Some, like laboratory experiments, can't be done online, and so there's a range. And as we look at that range of things that can be done online, we'll have to make individual decisions with particular classes as to what the right thing to do is. We believe that some instruction will take place in person, but under circumstances that minimize the chance of viral transmission, and we think that's okay. And there's some places, for instance, we have people in clinical training in our hospitals, so they'll be doing work there. That's not online. They're taking care of patients, and our hospital workers and others always have to protect themselves appropriately. And so yeah, we have a, excuse me, I was going to, a great time to cough. Let me do that. Let me model the right behavior. But we, our hospital directors, our health service workers, all of those people focus on these kinds of issues every day because they want to protect themselves as they're taking care of people. So we have this whole range of things, from things that can be delivered completely remotely to things that can't. And our job really as a living, learning community is to adjust ourselves to the right way to get the content to our students.
The university is obviously one of the largest employer in the area. In your letter, you mentioned telecommuting as an option and that more information will be coming on that. Are all university staff members being encouraged to telecommute right now, or what is the status of that?
What we'll do is, I'll say again, these things are changing a bit. What we said in the communication was those who can appropriately telecommunicate, we would encourage them to do that. This would be a good time to do that. We'd encourage them to do that. And that will be some fraction of our employees. Some might need to learn more to be able to do that. Some might not be able to do that productively or proactively. To be honest, as some do that, then that gives us a little more social distancing, so it doesn't really take everyone doing that to help make us safer. And those who come to campus will be, again, using appropriate public health measures to keep themselves as safe as possible. And what I said in the communication was that we'll develop this as we go along and do the best we can. I will say, if we had, this is one of those where if we'd said, let's wait until we have everything exactly perfect before we start, the virus isn't waiting for us. And so we really want to do the most we can as quickly as we can to get out front and be tuning on the way to make things as close to perfect as we can get them.
For students and families who are weighing the decision of whether to come back after spring break or stay at home with their families, what should they expect would be different at all if they come back? Will there be certain changes implemented, and isn't living in a residence hall or going to a dining hall in such close quarters, is that not just as much or greater risk than being in class with these people?
So the larger numbers of people in close quarters for a long period of time is the place where we think that those are the things that we fully expect have the highest risk. Being around people you're all standing about 3 feet apart. Next week maybe you'll stand 4 feet apart, but these kind of circumstances, no one is apparently ill or coughing or things. We think that these circumstances provide a relatively low risk. And so what we'll do all we can to minimize the risk in the dorms for those students who are living in the dorms. We'll use appropriate public health measures to make the food service and delivery circumstances that students find themselves using as safe as they can be. Again, we'll enforce appropriate social distancing. Certainly if someone feels symptoms or has a cold or is coughing or sneezing, we want to do what we can to separate those people, have them help us separate them from others, and we'll enforce those things. And so all those things that we know are likely to be helpful, we'll enforce. There'll be individual decisions made by individual families that, gosh, we think it's better to have our son or daughter stay at home, and our son or daughter has circumstances that allow them to complete their educational requirements from home, and that's a decision we'll leave to them to make individually. What we want to do is to make it as safe as possible for everyone who comes back and make this community here safe.
What will you do, have you thought about how you'll ramp up student health center and any screening, that sort of thing for coronavirus?
Yes, in fact, our health center has been working on this for weeks. First, ramping up for increased questions of people who come in, how to handle someone who has symptoms. And then we've been thinking quite seriously about preparing, I should say, rather than thinking about really preparing quite actively for cases that come to us. We are expecting to have cases, and we are fully prepared for some of those cases to be the most severe. So we have a full set of protocols in place at this moment and have for a week or more to be able to receive and do our best to provide the highest possible level of care to any cases that we receive.
How did spring break travel impact this decision?
One of the things that we were thinking about and that we, as we're trying to keep ahead of things is that as students come back, they will be coming back from a lot of different areas, and we don't know particularly that has increased their risk, but it could, and so we wanted to really be ready when they came back to make sure that we were in a different mode of public health preparedness. And so part of our really wanting to get our announcement out yesterday as quickly as we could is to help faculty prepare for students coming back in this new mode. And again, I appreciate the hard work that everyone did. We consulted broadly across our medical center and across our department, our school or college of public health, and our dean and other public health experts nationally. Appreciate all of their input over the weekend and yesterday in getting us to this decision and preparing us for the future. And appreciate, as I began, I want to end with my appreciation for the governor and the leaders in the state for really stepping out front and exhibiting leadership and guidance to help us to make these best decisions. And we're fortunate to have a governor who's so engaged and to have a public health enterprise that works so well together with us all. And so that it gives us good guidance and good confidence, and we want to be good partners as we work forward. I really appreciate seeing all of you. Thank you.
I know some of you had additional questions about online learning and distance learning. Mike Hofherr is the Chief Information Officer and is happy to answer your questions.
Hi, how are you? Just want to brief you guys very quickly on some of the things we are doing to support our teaching and learning mission. But first, say thank you to all of our faculty that are undertaking this enormous task. We know this is not easy, and we know that we're asking you to change in a very quick manner. So yesterday we launched a new website, keepteaching.osu.edu, that has a slew of resources available for our faculty, and we're focused on 4 key things. We're calling it Carmen 3 plus Zoom. So we want our faculty and are encouraging them to engage with Carmen, turn their Carmen courses on for students if you haven't been using that, get your syllabus uploaded, get your course materials uploaded, and start using the gradebook. The 4th thing is Zoom. Dr. Drake talked for a second about Zoom. That's the ability for you to broadcast your course. That is available to all of our faculty, staff, and students, and we're looking for them as they look at options on how they'll deliver their education. We have a large percentage of our courses already on the learning management system, which we call Carmen here. For our large section courses, anything over 100 students, we have 92, 95% of those courses already using the platform. So we're confident that a lot of our faculty are comfortable with the technology. But we know some aren't. And I have met with all the IT leaders across campus this morning. We've engaged with all of the deans this morning through the provost's office. Dr. Bruce McPherson had a call with all of us to start to talk about those strategies. And as we speak, we have about 50 to 100 individuals going through training at the distributed level to help our faculty with the delivery of these courses in this new model. So we are ready. We're here to help our faculty move forward. But we know this is going to be a challenge. We know it's going to be difficult. So keepteaching.osu.edu is our resource. Again, we could share that link with all of you. It's public and available. If you guys have any questions, I'd be happy to take them.
So it seems like it was kind of like a last minute thing. Why wasn't there prep leading up to this announcement at like 10:30 p.m. last night?
So we've been working. We tried not to make it sound like a last minute thing. We've tried not to make it feel like a last minute thing. A lot of these resources we already have available. So the last minute piece is pulling them all together so faculty could easily find them in delivering them in this new way. What you'll see is an established set of help and curriculum for our faculty that's been there for some time. So Keep Teaching is a new resource, but the ability to show our faculty how to use Carmen, how to use Zoom are things that we have and that we're repurposing in a new package.
Is there any threat for these types of technologies to crash with the increased volume using it?
So I'll never say never. There's always a threat. But we choose our vendors to scale. We scale here every day at Ohio State through the number of students that we provide education to. Zoom is a cloud provider that has the ability to burst and scale. The same with Carmen is a cloud provider, and they have the ability to burst and scale. We have been engaged with the leadership of both of those companies, and they are prepared for this, as we are not the only university going through this. Zoom is not only used by universities, but many companies across the country, across the globe. Carmen is one of the leaders in a learning management system and structure learning management system. And so they're prepared, they know this, they live on the Amazon cloud, they could burst, and we're ready for that.
Similarly, is there any worry about the strain that it might put on the internet? And I'm sure there are students who maybe don't have internet access as well.
Yeah, so two different questions there. I'll answer the first one, the strain on the internet. We're confident that we have the bandwidth to withstand this. We have great partners in OTEC across the state and have the capability, again, to burst through our internet services as well. Again, for students that don't have internet access, that sort of access point, that gets back to this personal decision that I think Dr. Drake talked about. So if being here and practicing good social distancing and good hygiene is the best way for you to access, then that's what we're encouraging, but if you could do that from home. And then if neither of those options work for you, we are going to put some mechanisms in place in the next few days here for you to contact us, and we'll work through you with some other solutions. So the message is we don't want to leave anyone behind, whether that's faculty, our staff, our students. We're here to help on all those fronts.
For departments that are already understaffed for school communication for the online courses, the grading's already behind. Is that a worry, especially when we're coming up on graduation, that grading might be delayed?
We're hoping that we won't be delayed. Obviously, these things are evolving hourly, daily. We are providing more resources to all of those colleges. Again, we're trying to take a lot of the tier one through my centralized help desk, which is how to use Carmen, how to use syllabus, how to post materials. We are providing extra resources to those colleges, and we are providing means for those colleges to work together to help solve these problems.